Today we want to talk about an issue that affects women, but also indirectly affects men, and it affects women who are pregnant and who have put to bed. It's something that oftentimes has become an issue of stigma. We want to talk about postpartum depression. By postpartum depression, I mean a form of depression that occurs after having delivered of your child.
What exactly is the meaning of postpartum depression? Now, when you hear of post, it has to do with after an event. Then when you hear of partum, it has to do with childbirth or delivery. Then when you hear of depression, it's a mental disorder that's characterized by sadness, severe sadness, loneliness, worthlessness, etc. So when you bring that together, you know that postpartum depression is a type of depression that occurs after childbirth. There's something called baby blues. It's also a type of postpartum mood disorders. This one can occur from the first day of childbirth, and it lasts for a few days, and it can go on its own even without medical intervention. But postpartum depression is this severe part of it, and it requires medical attention. So once you notice something like that, it's advisable you seek for medical attention.
People just think that women go to give birth and then they come back and everything is okay. So we get into what really causes this postpartum depression?
Okay, postpartum depression can be caused by a combination of various factors. Under there we have
oftentimes I've seen in places where people suffer these kind of things and they just get locked up. Sometimes they stab them. Some people say it's an evil spirit. You know, we're in a very religious climb where people think that almost everything can be linked to demons and to spirit. So it's essential that we know that when you see people like this who have intense emotion, negative emotion to be quite precise, after delivery, sometimes manifesting in them wanting to harm themselves or their babies or the other person, it could be that they are having postpartum depression.
Then another thing, postpartum depression can also affect men.
I thought I was out. I thought this thing did not concern me, okay?
And it is called paternal postpartum depression. Now, when you have a child,
what role can men play when it comes to seeking help and treatment? And I want to say that the truth is, when we talk about support, most men look at support like only money. Yes, money is good. Women love money, but it's not the only way.
Both genders.
It's not the only way that you can actually support them. And it's also essential that you help them around physically, help them around with physical chores. It's also essential that you stick with them emotionally. Okay, so if you have the blues, meaning that you're feeling a little bit of a mood swing after your delivery and you do not work on it, you push into depression where the mood becomes very down and becomes very intense. And if you don't do anything for it, if you don't do anything about it, it moves into the psychosis where we have other physical manifestation. And you start hearing voices in your head. They talk to you, they whisper to you, and you think you understand. I think that's where they start to blame village people. They say somebody's pursuing them and all those kind of things. Can this be helped? Can such women be helped? Is there any form of help that can be provided for them?
Yes, that's the treatment.
Yeah.
You can actually go through the process of...
Hello everyone, welcome to another episode of the Intimate Matters podcast. And on this podcast, we take you on a deep dive into the world of sexual and reproductive health. And as always, we bring you interesting topics to help you make informed decisions about your sexual and reproductive health. And just before we get into the topic for today, we have here an amazing personality, someone who knows the intricacies of sexual and reproductive health. Nosifon, thank you for joining us.
Thank you for having me here.
All right. So today we want to talk about an issue that affects women, but also indirectly affects men, and it affects women who are pregnant and who have put to bed. It's something that oftentimes has become an issue of stigma. We want to talk about postpartum depression. By postpartum depression, I mean a form of depression that occurs after having delivered of your child. And with me here, our guest is going to do justice to this topic, and I know that she's here and she's fully loaded. So let's start with the basics. What is postpartum depression?
All right, thank you. From the word postpartum depression, we've seen we have 3 words there. We have postpartum and then depression. So I'm going to tell you what these 3 words means. Then we join them together and get what exactly is the meaning of postpartum depression. Now, when you hear of post, it has to do with after an event. Then when you hear of partum, it has to do with childbirth or delivery. Then when you hear of depression, it's a mental disorder that's characterized by sadness, severe sadness, loneliness, worthlessness, etc. So when you bring that together, you know that postpartum depression is a type of depression that occurs after childbirth, and it's characterized by symptoms of severe sadness, loneliness, worthlessness, and shame and guilt. Thank you.
All right. So that means if after a woman is done giving birth and she comes back and she's feeling worthless and lonely, she's said to be suffering from postpartum depression.
Yes, if it's intense and severe.
All right. So is it something that we can look, and somebody who is not health related or somebody who is not specialized in that, is it something that you can just look, or are these just like symptoms that the person needs to, move forward and get to have like a clinical diagnosis or something?
Yes, but there's something called baby blues. It's also a type of depression mood disorder, postpartum mood disorder, sorry. This one occurs it can occur from the first day of childbirth, and it lasts for a few days, and it can go on its own even without medical intervention. But postpartum depression is this severe part of it, and it requires medical attention. So once you notice something like that, it's advisable you seek for medical attention.
Okay, so can we say that if an intense and, a baby blues that sticks, and doesn't go away after them few days or few weeks, like you said, can we say that a baby blues that keeps being prolonged becomes postpartum depression?
Exactly.
Oh, all right. Because it's important that we know that, because oftentimes people just think that women go to give birth and then they come back and everything is okay. So we get into, what really causes this postpartum depression?
Okay, postpartum depression can be caused by a combination of various factors. Under there we have the hormonal changes. Now there are certain hormones in the human body. When a woman is pregnant, it's high. That's the progesterone and estrogen. What does these 2 hormones do? It helps in the progress of pregnancy. Now when the woman puts to birth, these hormones drops immediately, and it's kind of connected to the brain, and there are some women that their body and the brain cannot adjust
to that sudden drop of the hormones.
So it might have an impact in their emotional states.
All right. Okay, so apart from the hormone and the biological aspects of it, because sometimes I've heard people say that maybe the kind of environment you find yourself during the process of pregnancy or during the process of delivery, the home you are, is there love at home, is there support at home? Can this also be like a cause of this postpartum depression?
Yes, it can. When you're not having the support you should have with your partner, your family, your friends, you're always isolated, it can actually be one of the causes of that. Falls under emotional factor. Okay.
What about are they just physical and emotional factors?
There are also biological factors. This is where we have the brain chemistry change.
Okay.
Yeah, there are certain neurotransmitters in the brain that has to do with our mood. Like it's responsible for happiness, responsible for sadness. They are called neurotransmitters, and it's the serotonin and dopamine. So when it reduces, it's not balanced enough for the brain to work with it. It might affect the mood of the woman.
Because I'm quite interested as a man, because there's something about ladies, especially when it comes to pregnancy. We see on social media, we hear around, once a woman is pregnant, they'll be like, give me fried burnt jollof rice. Or be like, I feel like to eat chalk and the rest of the thing. Now, some of them put this on the mood swings that come. Some of them put this on the hormones now. Because looking from this side, if I'm a man and my lady comes back maybe after delivery and she's having these mood changes, how then do I differentiate the one that is like a mood issue and this one that is actually something severe that I could know is depression?
Okay, the mood swing, the normal one, I don't think it happens often. Like this particular one is persistently.
Okay.
Yes, that one is normal now. At least I've witnessed it. I have eaten smashed yam before with tea, all in the name of craving for something from a pregnant woman. It's not persistent. That one is normal.
All right,
but
so
this one is consistent.
so this is for my men out there, because I had to ask this for my men out there. It's important that you could differentiate the one that is like a mood swing thing. I know sometimes it can be somehow for you when, you know, your woman is pregnant. Some of them crave for things that sometimes are not even in the recipe book and the rest of the thing. So when it becomes persistent, it's not just about a fluctuating changing mood. When it becomes persistent, so what are the things? Is it that this can happen to every woman, or that just some certain women that are more likely to have these issues than other ones?
Okay, some people feel that it's only women that put to birth, especially the first timers, like for the first time you are putting to birth, it's only them. But actually it can happen to any pregnant. In fact, if it happened to you the first time, you have higher chances of having it again during your next delivery.
Okay.
So it can happen to any woman of childbearing age. As far as you are giving birth, it can happen.
Okay. All right. So are there any other thing that we could look out for, that in as much as you're a woman that wants to bear your child, so maybe we're looking at what you're doing, we're looking at your environment, we can say that, this thing we did do, they like say you go get postpartum depression, or maybe because of what we're seeing around.
Okay. That's
like the risk factors that may predispose these people.
We have history of depression. If you've had any history of depression or any past mental disorder, either you or your family members, you're at high risk of having postpartum depression. Then complications during childbirth. Then premature, when you give birth to premature babies, those ones too, you're at high risk of having postpartum depression. And lack of support from your people around.
Okay. So, because I remember when I was still in school and I was doing one of my mental health posting, a lady was brought into the facility. She had a child just newly delivered, I think about a week or two. And she tried harming the child. Now, is this because apart from the intense emotion, the intense everything, are there some physical manifestation? Are there some physical things this woman is going to do that is going to show? Because she tried harming the child. So they said she had an issue, right? Mm-hmm. That they said she had a mental issue. That was even why she was brought into a mental hospital. I didn't stay long enough to know what it was. So when we have issues like this, could this be like physical pointers to the fact that this person is suffering from postpartum depression?
Yes. When you talk of postpartum depression, this person it's a mental condition. It's just that it's linked to pregnancy and the rest. That's why it's classified under reproductive health. This person has a mental problem, and definitely to affect how she thinks, how she behaves, and the things she does. Then it will show the symptoms of her having thoughts of harming the child or her own self.
Okay. So when a woman out there, if you notice that there's a pregnant woman out there who just gave birth and she's trying to harm her child, trying to harm people around her, trying to harm herself, maybe trying to harm her husband, it could be that possibly that there is a problem with her as it pertains to maybe she's suffering from postpartum depression. So can this be helped? Can such women be helped? Is there any form of help that can be provided for them?
Yes. That's the treatment.
Yeah.
You can actually go through the process of CBT. CBT is cognitive behavioral therapy. It helps to work on the negative thought or pattern this woman has. Okay. That one will be done by the professional therapist, mental health personnel. Yes. Then also some medications like the antidepressants can help to balance the serotonin and dopamine, the neurotransmitters in the brain. Then joining other support groups.
Okay.
Like having to have discussions with other women that have this particular situation. At least you know that you are not alone in this.
Okay.
Then also hearing their testimony, be like, okay, I have hope. Something can actually be done.
All right. So we're talking about testimony, not the one they say in church that it started in 1995. No, not that one. The fact that you listen to people say that they've been here before you and they've been able to go through this and they've come out whole, they've come out better. This is something that helps you, putting yourself in the environment of people like you. So, you could know that you're not actually alone. And this is quite important for these women out there to know, because oftentimes I've seen in places where people suffer these kind of things and they just get locked up. Sometimes they stab them. Some people say it's an evil spirit. We're in a very religious climb where people think that almost everything can be linked to demons and to spirit. So it's essential that we know that when you see people like this who have intense emotion, negative emotion to be quite precise, after delivery, sometimes manifesting in them wanting to harm themselves or their babies or the other person, it could be that they are having postpartum depression. I want us to talk about an aspect because, this postpartum depression, this is like a woman thing. It's only women that goes through the process of delivery. Let's talk about men. So, what can men do in this, in all aspects? Where do men fit in? Okay, let's start it this way. Where do men fit in when it comes to like causes of postpartum depression? Where do they fit in?
When it comes to the causes
of postpartum depression.
Maybe you're not giving your wife the necessary support she needs at that moment. The love she needs at that moment. Everything is just, pregnant women now, at that point in their life, they need all the love, all the support, all the help in carrying out house chores and the rest. So when you are not doing that, it would actually affect her. Then another thing, postpartum depression can also affect men.
I thought I was out. I thought this thing did not concern me. Okay.
And it is called paternal postpartum depression. Now, when you have a child, that's when you and your mom just, your wife just put to bed.
Mommy is okay. Some people call their wives mommy.
Sorry about that.
No, some people call their wife mommy. I may plan to do mine too.
Okay. Now, you need to adjust.
Okay.
You have to help her in taking care of the baby. And when this man is unable to adjust to this particular situation, it will actually affect him because the workload will be too much. Imagine you are looking for how to hustle for the family. The pressure will be too much. And you're also thinking of, how to look after your wife, how to take care of the child, how to make sure you prepare meal for the child, how to make, it will be too much. And it might lead to what is not supposed to lead to, and depression might set in.
All right. So men out there, it's important, that you can be a problem to your wife. You can lead her down the road towards depression when you are not a good support system to her during the process of pregnancy. It's quite essential that you really, really support her. And I want to say that the truth is, when we talk about support, most men look at support like only money. Yes, money is good. Women love money, but it's not the only way.
Both genders.
It's not the only way that you can actually support them. And it's also essential that you help them around physically, help them around with physical chores. It's also essential that you stick with them emotionally. Pregnancy is a roller coaster. So the woman needs as much help as she can get. It's not easy to be growing a full human being inside of you. It's not something that should be taken quite lightly. So please, while you're putting out the money, also ensure that you support. And I know if you watch our previous episodes, you see separate ways you can support your wife, especially as it pertains to antenatal. Sometimes you follow her to the clinic, you go and rub her waist. You also follow her, you go and exercise and you dance together. And also for you to know that it's not only on your wife. The effect of the pregnancy on your wife can also affect you indirectly. I think this even points to a fact that there's something we call covert syndrome, where a man becomes pregnant, where because of the wife being pregnant, he starts to manifest. And no, seriously, he starts to manifest the same symptoms like the wife. Now, don't forget that we're living together. A man and a woman is living together in the same environment. So if the wife changes, for example, diet, the husband most likely will change diet.
Yes.
So if your wife say, I don't want to see rice anywhere close to me, that means throughout that 9 months, you're not eating rice.
No rice.
Yeah. So it's important that men also know this. So what role can men play when it comes to seeking help and treatment? Where do they fit in when it comes to seeking help and treatment?
Okay. At this point, if this woman is not able to speak up, because some of them, it might be difficult to speak up. Think the husband now, since you know what is wrong with your wife, you are the position of maybe referring to the medical personnel. This is what is happening. These are the symptoms I've been seeing and stuff. So I think that will help. And also seeking for help from people around, that's your loved ones, family. Yes.
Okay, so if you're a man and you're out there and you're seeing your wife put out these symptoms, it's important that you don't just close your mouth. Some people say that a closed mouth is a closed destiny. So you start to ask questions, especially newbie dads, like first time dads. Those people used to suffer. You see them in the hospital. They don't even know their left from their right. They don't even know what to do. So it's essential you ask questions.
Yes, and if you don't speak up, it might lead to, remember I said that postpartum depression is one of the type of postpartum mood disorder. That is their other ones, stage by stage. The baby blues, if you don't speak up, it will lead to the postpartum depression. Then if you don't still speak up thinking miracle will happen, it will lead to postpartum psychosis, and that's the worst. It's over.
Oh wow. So you see, so speak up so that you don't travel from one stage to the other until you travel over. It's quite essential that we speak up. Now, talking about speaking up, because this is always an issue. How do I, yes, because it can also affect the man. How does a man or a woman handle the fact that if I speak up, because it's depression, right? And people know depression is a mental stuff. And we know the mindsets we have here that anything mental, anything psycho, small time you go come out clothes, they waka for. So how do I speak up? And how do I manage the fact that if I speak up, people will stigmatize me and say I'm mental, right? Now, why I'm saying this is that don't forget the fact that you said that it can run in families, right? If there's an history. So wouldn't I be afraid that if I speak up today, that the village people will keep it and hold it against my daughter? Like, my people will say, so how do we manage the fact that people should speak up and stigmatization?
Now, you cannot see fire and still carry your hand to go and put inside that fire.
Okay.
You are seeing something is happening and it's not the pattern, you are not okay with it. That's why they're always praying in church. I break every patterns that are not going well. You see that this thing is not right and it's affecting you or affecting your family negatively. For me, I will talk. There is nothing village people can do to me.
Okay.
Yes. Because when you keep quiet like that, it will lead to, God forbid, it happens to you. And you get to a point where you cannot control it again. There's nothing you do. You keep on saying village people. So I feel you should keep doing medical checkups. Go for checkups. Attend mental
health care and get checkup.
Yes, and get the necessary awareness you should know concerning this thing in case it should happen. You know that, okay, this is what I'm going to do. This is what I'm going to do. So frequent checkups, mental checkups would.
All right. So she mentioned awareness about, getting to understand this topic, because that's an essential thing. When people understand a thing, they tend to appreciate it more. They tend to utilize it more. And that is why we here at the Intimate Matters podcast, we bring you information such as this so that you have this awareness and you can take the right decisions as need may be for you to take it. So I'm also going to shift down to us, the medical professionals. Now, because I'm saying this because there are studies to this effect, and when you interact with people out there, people who come to seek care, there's something they usually say: attitude of health professionals, right? Especially for issues like this, that there is a likelihood for stigma. So how can my attitude as a nurse, or the attitude of the psychiatrist in the hospital, or the attitude of the medical recorder, how can it either influence positively or negatively on people who have this issue coming to seek help?
Okay, first off, as a medical professional, when you see people with this condition, you shouldn't be, if other people like the society are talking that when you have mental problem, this and that, and you as a medical professional should be different. You shouldn't join them to make things worse. You should be non-judgmental. Draw them closer. Make them understand that you love them. Make them understand that there's actually help. You can actually offer that help they need in order for them to live a healthy life.
Okay, because it's essential we put it out there. Sometimes saying this to my shame, we see medical professionals out there, the way they treat people that come in with whatever kind of disease, especially diseases like this that are prone to stigma and the rest, and the way they act on these people could become a problem. So just out of curiosity, I know we're talking about postpartum depression. You mentioned something about postpartum psychosis, right? So how does it to an extent differ from the depression?
Okay. Postpartum psychosis, it occurs for a very long time, like lasts longer than postpartum depression. It can last for like a year or more than.
Okay, so it's a product of duration.
Yes, and also this is where other mental health symptoms comes in, the hallucination, where you see things that are not real, existing. Delusion, having false belief.
Okay, so if you have the blues, meaning that you're feeling a little bit of a mood swing after your delivery, and you do not work on it, you push into depression, where the mood becomes very down and becomes very intense. And if you don't do anything for it, if you don't do anything about it, it moves into the psychosis, where we have other physical manifestation. And you start hearing voices in your head. They talk to you, they whisper to you, and you think you understand. I think that's where they start to blame village people. They say somebody's pursuing them and all those kind of things. So mothers out there, mothers to be, fathers out there, fathers to be, people who have pregnant people around them, it's essential that as much as you can, that you support the people who are going through the process of childbirth and delivery. This is to ensure that they stay well, they stay healthy physically and also psychologically. Because I think that's the thing when it comes to pregnancy and delivery, we have a whole lot of care for people physically.
Yeah. So
they'll be like, bad this, don't use this and the rest of the thing, but psychologically is a problem. So thank you so much, Nurse Sifon, for coming. Do you have any last words for the audience out there as it pertains to this and also as it pertains to general maternal care?
Okay. First, I would say, they always say health is wealth. You cannot make that wealth if you are not healthy enough. As a mother, I feel giving birth is something exciting. It's something you should be happy about. But when it deviates from the normal, that's when issues come. And I want to encourage anyone or all the mothers out there, you should try to speak up when necessary. Your emotions are valid. There is help actually out there. There is support out there. And also, in all you do not forget to always put everything in God's hands, because I believe with Him, all things are actually possible. Thank you.
Oh, all right. So you don't forget to put all things in God's hand. That's my mommy G who's sitting across from you. So it's essential that you do that. But I'm not going to say I feel bad, because I know I said maternal, but you said this thing also affects us. Why didn't you give advice to the daddies in the house?
I'm so sorry.
Okay. Apologize to them and also give them advice.
I'm so sorry to the men and daddies out there. So, I also want to urge you all out there that if you are also going through paternal postpartum depression, there's also help for you out there. You should also try to speak up. Yeah, the same encouragement I gave to the mothers, you can also adhere to the same.
Okay, so she said same to you, just like she had given to the mothers, men out there, women out there, when you're going through the process of pregnancy, please get as much support as you want. I think that's why it's also important that as a rule of thumb in sexual and reproductive health, we tell you that it's very much okay for you to practice safe sex. Don't get pregnant for somebody who is not going to support you. It's not a journey. It's not a little journey. It's a journey that is going to take so much from you, physically, psychologically, and otherwise. So it is very, very essential that you do that. So we want to appreciate you for sticking around for this episode of the Intimate Matters podcast. You know, we are on all social media platforms. We are on YouTube, we are on Facebook, we are on Instagram, we are on TikTok. And we would like to engage with you. So engage with us on our social media platforms. And you can also find the link to join our official WhatsApp chat, where you can drop your comment, you can ask your question, and we'll be glad to oblige you. And if you have any topic you would want us to speak about, please do well to drop it in the comment section. Do well to send it to us, and we'll be glad to discuss with you. We're looking forward to a time where we might have interaction with you and where we would get to answer your question. This is the Intimate Matters podcast, where we believe that your intimacy matters. And I am your pilot as we take on this drive. My name is Nurse Akwaowo Akpan, and this is me saying goodbye for now.